Okay, we will be going over NCMHCE therapeutic counseling techniques. There are several techniques that are used to treat various disorders in the counseling field. Existential techniques include encouraging responsibility, clarification of options, life review to discover meaning, development of belief system, and paradoxical intervention. ODD and conduct techniques include oppositional defiant disorder and conduct disorder techniques include focus on consequences, reinforcements or rewards, methods that delay impulses by using cognitive strategies such as stop, listen, think, anger management. ADHD techniques focus primarily on behavioral techniques, enhancing the learning environment through reduction of distractions, training teachers, instruction on time management, stress management and relaxation techniques, loss of contact techniques. Target symptom elimination or reduction. Individual therapy is the usual mode. Hypnotherapy for amnesia. Psychodynamic for multiple personality. Behavioral therapy for developing coping mechanisms. Behavioral techniques and stress management. Group therapy is not generally indicated. Personality techniques. Individual therapy. Personality techniques, individual therapy, family therapy with improvement, group therapy may be useful. Psychodynamic approaches are generally used to promote changes in relationships. Cognitive interventions may be used, medication is rare. Gestalt techniques, unfinished business, giving voice to physical sensation, dream exploration, empty chair, top dog and underdog, exaggeration of feelings and actions, confrontation, and encouragement of awareness of responsibility. Somatoform techniques, physical examination should be part of the assessment process. Individual therapy is the primary mode. Family therapy may help. Holistic approach with cognitive, behavioral, and affective therapies combine the most effective modality. Depression techniques. Cognitive behavioral techniques are the most effective. Target overgeneralization, perfectionistic thinking, and tendency to catastrophize. Training and communication skills help in decision making, assertiveness training, increasing pleasurable activities. Anxiety techniques. Physical exam, generally indicated, cognitive behavioral and behavior therapy, in vivo work, well except in the case of generalized anxiety disorder, anxiety management, relaxation, guided imagery, stress inoculation, problem solving, progressive muscle relaxation, meditation, biofeedback, and exposure. Most effective therapy is behavioral in approach with a secondary focus on cognition. Group therapy may also be helpful, but individual is most indicated. Ancillary family therapy may be needed as well. Unless the condition is disabling, medication is not generally needed, save in the case of panic disorder and obsessive compulsive disorder. Adjustment techniques. Crisis intervention, brief psychodynamics, stress management, short-term interventions are most appropriate. Psychodynamic techniques. Transference, exploration of dysfunctional patterns, relationship history, discussion of dreams, childhood memories, hypnotherapy, interpersonal, unconscious conscious interpretation. Adlerian techniques include life script, guided imagery, empowerment and encouragement, birth order, early recollections, role playing, natural consequences, phenomenological approach, and development of social interest. Therapeutic technique definitions will be reviewed. The vocabulary for different therapeutic techniques include and will be reviewed. Acceptance and commitment therapy uses acceptance and mindfulness strategies with commitment and behavior change to increase psychological flexibility. Bibliotherapy, use of books or writings pertaining to self-improvement, is a form of homework. Cognitive reframing consists of changing the way people see things and trying to find alternative ways of viewing ideas, events, situations, or a variety of other concepts. Cognitive rehearsal. The patient imagines a difficult situation, and the therapist guides him through the step-by-step process of facing and successfully dealing with it. The patient then works on practicing or rehearsing these steps mentally. Cognitive restructuring, the process of learning to identify irrational or maladaptive thoughts and challenge their veracity, using strategies such as logical disputation. Covert desensitization, the linking of an undesirable behavior with imagined punishment. Covert extinction, imagining an unwanted habit, etc., to be decreased, and then imagining a reward being given for the imagined success, used in treating paraphilias. Covert reinforcement, things one says or does to oneself to make oneself feel good or bad. Homework, cognitive therapists often assign homework between sessions. Written, keep a record of events, interpretations, and feelings. Behavioral, perform certain behaviors to examine the validity of a cognition that may be illogical. Identify thinking errors, journaling, self-talk. These are all examples of cognitive technique examples. Abriation, an emotional release resulting from mentally relieving or bringing into consciousness through the process of catharsis a long repressed, painful experience. Catharsis, the process of releasing and thereby providing release from strong or repressed emotions. Body awareness, helping clients to make connections between their emotions, thoughts, and physiologic responses. Empty chair technique, typically used in Gestalt therapy to explore patients' relationships with themselves or other people in their lives. The technique involves the clients addressing the empty chair as if another person was in it. Psychodrama role play. Clients utilize spontaneous dramatization, role-playing, and traumatic self-presentation to investigate and gain insight into their lives. Stress inoculation. Patients are educated about stressful situations and the general nature of stress, the negative outcomes they may be vulnerable to experiencing when confronted with stress, and steps they can take to avoid these negative outcomes. Assertiveness training. Assertiveness training is a type of behavioral therapy or skills development program that teaches individuals how to behave more boldly and self-confidently. An assertive person is a strong advocate for their rights and the rights of others, but avoids embodying abrasive qualities such as aggression, cockiness, and ego. Aversion therapy. Patient is exposed to a stimulus while simultaneously being subjected to some form of discomfort. Behavioral extinction. Removing rewards to stop an undesired behavior. Clinical modeling. Therapeutic demonstration of desired behaviors. Contingency management. A type of treatment used in the mental health or substance abuse fields. Patients are rewarded or less often punished for their behavior, generally for adherence to or failure to adhere to program rules and regulations or their treatment plan. Flooding, a form of exposure therapy in which the client is exposed to their painful memories with the goal of reintegrating their repressed emotions with their current awareness. Systematic desensitization, a type of behavior therapy in which phobic responses are reduced by apparent relaxation with a series of mental images of real-life situations that the person finds progressively more fear-provoking based on the principle of counter-conditioning. In vitro, the client imagines exposure to the phobic stimulus. In vivo, the client is actually exposed to the phobic stimulus. DBT, dialectical behavior therapy, focuses on high-risk, tough-to-treat patients. These patients often have multiple diagnoses. DBT is designed to treat people with borderline personality disorder and suicidal behavior, adapted to help with another person's mental health problems that threaten a person's safety, relationships, work, and emotional well-being. It is in the CBT family, so it is worth considering on the exam. Family mapping genogram. Genogram is a family tree, but with additional information that can be very helpful when trying to understand complex family and relationship dynamics. Genograms can be used to map out a mental health history, physical health history, and even addiction and substance abuse history. Therapy techniques. Adlerian psychotherapy, appropriate for issues of goals and direction. Examination of life script, guided and eidetic imagery, empowerment and encouragement, analysis of birth order and family constellation, early recollections, role-playing, natural and logical consequences, development of social interests, Adlerian techniques interventions, parent-child problems, acting out behaviors, career crises, marital concerns, low self-confidence, examples of when to Adlerian therapy. Behavioral therapy targets dysfunctional behaviors, works by altering actions for clients with low to moderate functioning. Eating disorders, conduct disorders, substance use disorders, impulse control disorders, conflict disorders, phobias, sexual disorders, suicidal behavior, family conflicts, relapse disorders, and some sleep disorders. In connection with CT helps to alleviate depression, anxiety, and personality disorders. These are all examples of when to use behavioral therapy. Establishment of a baseline, behavioral contracting, homework, use of rewards and penalties, aversion therapy, natural consequences, incompatible alternatives, reinforcement schedules, cueing, anchoring, flooding, in vivo desensitization, biofeedback, role-playing, modeling, assertiveness training, token economy, activity schedule, acting as if or all examples of behavioral therapy techniques. Cognitive therapy. When symptoms are described in terms of cognitive dysfunction, low to moderate functioning, clients benefit most. Examples of when to use cognitive therapy include if a client is dealing with depression, anxiety, mild situational disorders, and bulimia nervosa, adjustment disorder, personality disorder. Cognitive therapy techniques include analysis of dysfunctional thinking patterns, cognitive restructuring, hypothesis testing, mental and emotional imagery, cognitive and covert modeling, thought stopping, meditation, self-talk, record of dysfunctional thoughts, diaries of events, thought, reaction, argument, letter writing, rating of activities for mastery and pleasure, Beck depression inventory, hourly mood graph, affirmations, systematic assessment of alternatives, grids to evaluate relationships, existential psychotherapy, goal of changing meaning, indicated for high functioning individuals, encouraging client responsibility and self-confidence, clarification of options, facilitation of choices, life review to discover meaning and accomplishments, development of spirituality, discussion of belief systems, paradoxical interventions, existential psychotherapy techniques. So for Gestalt counseling, it is used in combination with other cognitive and behavioral approaches applicable to individuals who have moderate to high functioning, for individuals who channel ongoing concerns into somatic complaints, can provide access to feelings with a goal of unblocking blocked feelings. Gestalt therapy techniques include unfinished business, giving voice to physical sensation, nonverbal cues, dream exploration, empty chair, top dog, underdog, exaggerating feelings and actions, confrontation, encouragement of awareness and responsibility, person-centered, for use with high-functioning individuals exhibiting minor concerns and desiring personal growth, effective with disorders involving self-esteem and self-confidence, helps to build rapport while assisting the individual in reaching personal insight. Person-centered techniques include acceptance, unconditional positive regard, empathy, reflection of feeling, support, encouragement, clarification, open-ended questions, goal setting, genuineness, modeling, rapport building. Severely narcissistic, borderline, masochistic, or oppositional personality pattern, factitious disorder, or malingering. These are individuals that are likely to be harmed by treatment. Brief psychodynamic psychotherapy, crisis intervention and stress management, treatment of adjustment disorders, insight-oriented approaches and behavior-based techniques, focusing on feelings, play therapy, and Adlerian therapy are all insight-oriented approaches. Reward, consequences, and reinforcement are behavioral techniques which are used for the treatment of children. Treatment of adolescents include reality therapy, peer cultural groups, and social skills training. Treatment of autistic spectrum disorder includes behavioral therapy, daily living skills, for higher on the spectrum social cognitive method with speech and language pathologists to deal with social and everyday problems. Behavioral techniques, goals of increasing the child's ability to learn, medication management, treatment of ADHD, treatment of oppositional defiant conduct disorder, residential treatment programs, day programs, or combined school community facility, techniques that focus on consequences, reinforcements, or rewards, cognitive strategy, anger management, behavioral therapy may use medication, behavioral therapy, PICA, medication, tic disorders, behavioral approaches, elimination disorders, behavioral approach encopresis, behavioral therapy medication, enuresis, insistent, firm, empathetic, consistent, positive bolstering for desired behaviors, treatment for separation anxiety disorder, medication for the treatment of delirium, supportive psychotherapy for families adjusting major neurocognitive disorders, substance related and addictive disorders. Techniques include 12-step programs, in and outpatient care, CBT, group therapy, inpatient short-term rehabilitation, inpatient long-term rehabilitation, methadone maintenance treatment, least effective at psychodynamic substance-related and addictive disorders. Hypnotherapy for amnesia and psychodynamic psychotherapy for DID. Behavioral therapy can help with developing coping skills and stress management. Family therapy, medication disorder involving loss of contact with reality. Behavioral therapy, social learning programs, family education, social skills training, and vocational rehab medication schizophrenia. CBT and psychodynamic meds, delusional disorder. Psychoeducation and CBT, supportive psychotherapy, brief psychotic disorder. Depressive and bipolar related disorders, CBT, interpersonal and related interventions, family therapy or group. CBT, interpersonal psychotherapy, medication, sometimes psychodynamic for depression. Persistent depressive disorder. Techniques include supportive, cognitive behavioral therapy, and interpersonal psychodynamic, as well as medication. Anxiety disorders. Techniques include cognitive behavioral therapy and behavioral, in vivo, cognitive and behavioral techniques. Panic disorder. Behavioral, CBT, psychoeducation and psychodynamic, meds, relaxation therapy, bibliotherapy, panic disorder. Cognitive behavioral therapy, family therapy, interpersonal psychotherapy, psychodynamic therapy, psychoeducational approach, behavioral or CBT medication for agoraphobia. For specific phobias, techniques include cognitive, behavioral, CBT, psychodynamic, and group therapy. OCD, obsessive compulsive disorder. Techniques include behavioral, cognitive behavioral therapy, rational emotive, exposure and response preventions is most successful, and medications. Post-traumatic stress disorder. Techniques include eye movement desensitization, EMDR, exposure therapy, as well as medication. GAD treatments include CBT, cognitive restructuring, behavioral, which includes self-monitoring, relaxation, as well as exposure. Factitious disorder. Techniques include cognitive behavioral therapy, reality and psychodynamic, hypnosis, and face-saving techniques. DID techniques include psychotherapy, cognitive therapy, creative therapies, or clinical hypnosis. Dissociative amnesia. Psychotherapy, cognitive therapy, family therapy, art therapy, music therapy, clinical hypnosis, which are all techniques for dissociative amnesia. Depersonalization derealization disorder techniques include psychotherapy, cognitive therapy, family therapy, creative therapies, clinical hypnosis. Disruptive, impulse control, and conduct disorder techniques include behavioral, education, focus on aspects of the client's life that have been harmed by dysfunctional behaviors, group work, and family therapy. Erectile disorder techniques include behavioral therapy targeting performance anxiety, cognitive therapy, individual psychotherapy, systematic approaches, psychoeducation, and psychodynamic, sensate focus, erectile disorder, behavioral approaches, insight-oriented psychotherapy, group therapy, family therapy, which challenges distortions used to enhance self-esteem, social skill training, assertiveness training, group therapy, anorexia nervosa techniques. So techniques for bulimia nervosa include cognitive behavioral therapy, psychodynamic, group, psychoeducation, family therapy, body image, and self-esteem. Sleep, wake disorders, insomnia stimulus control therapy, sleep restriction therapy, relaxation training, and CBT, medications. These are the techniques for treating sleep-wake disorders. For personality disorders, the techniques include individual therapy accompanied by family, couples counseling, group, psychodynamic interventions, as well as cognitive interventions. So these are the different definitions for different techniques. Assertiveness training, learning to stand without being pushed down or pushing back. Group therapy can be a safe setting for practicing assertiveness. Aversive control, CBT technique using punishment and criticism to eliminate undesirable responses, commonly used in dysfunctional families. Aversive counter conditioning, a form of treatment whereby pairing a stimulus or behavior with an aversive stimulus reduces the attractiveness of that particular stimulus or behavior. Behavior modification, a set of procedures for changing behavior, especially by using behavior therapy and operant conditioning techniques. Behavior rehearsal, techniques consisting of trying out in therapy new behaviors that are to be used in everyday situations. Bibliotherapy, used in feminist therapy where a therapist provides reading materials such as books to help personal growth as a supplement to the sessions. Chaining, linking behaviors in a series resulting in each behavior both being the reinforcement for the previous behavior and the stimuli for the next behavior. Circular questioning, used to devise questioning and transform linear, casual chains of thought into reciprocal, interdependent worldviews. Classical conditioning, pairing a neutral stimulus with an unconditioned stimulus, which then induces a reflex or response. Cognitive behavioral modification therapy, cognitive restructuring, a process for understanding how the client interprets the experiences affecting behaviors. Emphasis is on irrational ideas, perceptions, and interpretations of individual experiences. Coloring therapy. The activity of coloring itself is used to help quiet the mind, listen inwardly, and open up to higher knowledge, healing, and creativity. Confrontation. Used in Gestalt therapy, the therapist meets their own agenda for the client and acts as the expert, giving power and control to the therapist. Using the confirming stance, the therapist acknowledges the entire being of the client. Constructed response item, an exercise for which examinees must create their own responses or products rather than choose a response from an enumerated set. Contingency contracting, behavioral therapy technique. Agreements are made between family members to exchange rewards for desired behavior. Coping questions. Therapists ask the client questions to bring awareness to their own resources and natural coping skills. Differential reinforcement. Program combines extinction of unwanted behavior with positive reinforcement for positive behavior. Disputing, process in which the therapist challenges or disputes the client's irrational beliefs. Dream work, Freud used this in psychoanalysis and Gestalt, process whereby latent dream content becomes apparent. EMDR, eye movement desensitization response. Exposure therapy used for clients dealing with traumatic memories. CL processes memories while focusing on external stimulation such as lateral eye movements. Empty chair. Gestalt therapy technique to process interpersonal problems by which the client role plays to unfold conversations he may have had with an individual. Enactment. Used in structural family therapy. Therapist has the family recreate conflict situations that occur at home. Evoking. Client is invited to get in touch and expand on their own knowledge and experience in order to cultivate their desired change or goals. Exaggeration repetition game. Gestalt therapy, client exaggerates a movement or gesture by repeatedly intensifying feelings attached to behavior to make inner feelings clear, such as trembling of hands or feet. Exception finding questions. The therapist asks the client questions that will help the client recognize occurrences when a problem did not exist or what the client did differently during the problem. Family art therapy. Conjoint family therapy. Client is asked to produce a series of drawings used to warm families up to be able to express themselves. Family mapping. Therapist draws a diagram to identify boundaries, underlying structure, and transactional styles. Family puppet interview. Conjoint family therapy. Client is asked to make up a story using puppets as a vehicle for highlighting conflict and alliances. Family sculpting. Conjoint family therapy used to demonstrate current family interactions or past memories of the family to arrange others. Family ritual. Used to prescribe a specific act for family members to perform that is designed to change the family system rules. Flooding. Used to treat phobias in which the client is treated through prolonged imaginal or in vivo exposure to the fear stimulus until the extinction of the response. Free association developed by Freud. Observation of the client as thoughts or words spontaneously come to mind, flowing from one to another. Gender role analysis. Utilized in feminist therapy, where therapists help the clients become aware of how gender role expectations have negatively affected them here and now. Rather than focus on the past or what might happen, therapists help the clients to fully appreciate the experience of the present moment. Internal dialogue exercise. The process by which to distinguish the struggle between the top dog and underdog and integrate them into the individual. Invariant prescription technique. Milliam systemic model. First, they would instruct parents to tell their children they have a secret. Parents were told to leave together randomly for varying periods of time after telling their children that they had a secret. When parents mysteriously disappeared together, they were instructed not to tell other family members where they were going or doing. They would continue using the invariant prescription with a specific family until the identified patient symptoms decreased. In vivo desensitization. CBT used for anxiety and phobias, directed to face head-on the issue they fear. Joining. Therapist supports the family and leadership position while developing and maintaining a therapeutic alliance. Labeling. One explains a situation or behavior by labeling it rather than overgeneralizing it. Linking. Helping members bridge common concerns for shared problems and connect the members that do. MADD. Love withdrawal disciplinary technique in which caregivers express disapproval by ignoring, isolating, or express lack of love for their child. Making the rounds. A person is asked to speak to or do something with another person within a group setting in order to try new behaviors such as taking risks, confrontation, or disclosing self. Miracle question. Using solution-focused therapy whereby the therapist asks the client a question on if a miracle occurred overnight and all of their problems were solved, what might be different? Negative reinforcement. Behavior or response is strengthened when an unpleasant stimuli is removed after a specific behavior has occurred. Negotiating. The process by which the client is invited to describe their problems in a way that creates space for future possibilities. Non-contingent reinforcement. The delivery of reinforcing a stimulus on a response-independent basis. This is an element of behavioral therapy. It's commonly used in addressing aberrant behaviors. Operant conditioning. The use of consequences or reinforcement to learn a new behavior or strengthening of an existing response. Paradoxical injunction. Used in strategic approaches. The therapist instructs the family members to continue their symptomatic behavior. Personality reconstruction. Therapy where the basic structure of the client is restructured to create an integrated individual. Positive connotation. Milan model attributes positive motives to family behavior in order to support cohesion within the family and circumvent resistance to therapy. Positive feedback. To maintain a stabilized state within the system by increasing a behavior and amplifying activity. Positive reinforcement. A behavioral response is followed by a pleasant stimuli or reward, which evokes a desired response and then increases the frequency of that behavior. Premack principle. Technique where the therapist uses a high probability behavior. Primary vicarious conditioning occurs when the observer sees the model's behavior reinforced and then she performs the same behavior. Process question. Using Bowenian therapy to slow an individual's process and lessen reactivity in order for them to recognize and take responsibility for their own behavioral patterns and interpersonal relationships. Projective techniques used in psychoanalytic therapy. They are based on Freud's defense mechanism of projection. Therapist helps the client face buried issues by projecting them someplace else so that the client can look at the issues from an open point of view, hoping that the client will feel no longer threatened by them. Rational emotive therapy. Rational emotive imagery, a form of intense mental practice for learning new emotional and physical habits. Client imagines themselves thinking, feelings, and behaving in exactly the way they would like to in everyday situations. Regression techniques. Retrieving data from an earlier time in one's life in order to bring about a positive change in the present for examining causes and formation. Reframing and relabeling. The therapist reframes the behavior and problems of the client by taking into account the influences of societal factors. Rehearsal exercise, Gestalt. Instead of rehearsing a role or conversation internally, the therapist has the client rehearsing an exaggerated exercise and movement to bring clarity to the inner meaning attached to the fear around new behavior. Rehearsal technique, Gestalt. Therapist attempts to help the client integrate aspects of himself by having them role play the opposite of symptoms or behaviors the client may be experiencing. Role playing. Allowing the individual to assume the role of another individual to allow all involved to observe how they are perceived and received. Scaling questions. Therapists ask their clients to gauge their problem using a scale of 1 to 10. Secondary vicarious conditioning occurs when symbolic representations of behavior and its consequences are absorbed through reading, looking at maps, or other images from a verbalized description. Self-disclosure. Therapists use self-disclosure as an attempt to balance out the therapeutic relationship. Self-monitoring. The process of observing one's own behavior and patterns as well as one's interaction in various social settings. Self-report refers to techniques in which the person being appraised is asked directly for his own evaluation on the dimension of interest. Shaping. Conditioning used to encourage specific behavior by rewarding actions that come increasingly closer to the desired behavior. Shame attacking exercise. REBT strategy of encouraging people to do things despite a fear of feeling foolish or embarrassed. Social referencing. The use of emotional signals, cues from others as a guide for one's own behavior in an ambiguous situation. Staying with the feelings. Gestalt. Therapist attempts to prevent the client from Avoiding unpleasant behaviors by encouraging him to go deeper into the feelings or behavior. Stress inoculation training. Cognitive behavioral modification education. Rehearsal and application phase. Positive self-statements. Daily journal of dysfunctional thoughts. Noting situations and emotions that trigger irrational beliefs. Structured exercise. Techniques used for achieving a particular goal in a set amount of time that can enhance interaction and provide a focus for work or promote member independence. Summary bridging question. If you continue to practice the things that you are doing, will it keep you on the path towards your goals? Systematic desensitization. Client is taught to relax while imagining a greater series of progressively anxiety arousing situations. Timeout. Behavioral technique for extinguishing undesirable behavior. Token economy. Rewards desired behaviors with tokens such as poker chips, stars, and a script that can be saved and traded for another reinforcement. Unconditional positive regard. They believe people are all right despite their actions, acceptance, and caring for all members. Vicarious conditioning. A child can learn by observing another's experience with classical or instrumental conditioning. Vicarious punishment. An observer watches the model get punished for a particular behavior and chooses not to do the same thing.